Good morning. I'm Ashley James from Good Morning Maryland. Thank you so much for joining us. We are on Facebook Live right now because today is a day of answers and we are talking about the flu. I'm here with Dr. Hira Shakeel, a resident at GBMC. Thank you so much for joining us. And you know, the flu is just a hot topic right now. So I want you to jump on, ask any of your questions. This is the time to do it. This is a really interactive conversation, and just jump on Facebook Live. I will ask the questions to Dr. Shakeel. And I want to start by just asking, you know, the simple question of what are some of the main symptoms that should raise a red flag to us for our kids or ourselves?
Yeah, so I think flu, everyone knows it, everyone has it. It has body aches and pains, dry cough, fever, you know, just a malaise feeling that you're very tired and you have runny nose. Those are the symptoms you want to look out for, and you know, just head towards your primary care physician or ER. Okay.
When do we know that it's time to go to the ER? When do we say, okay, this fever is too high or these symptoms are too severe?
I mean, initially, if it's mild, you can just take care of it at home with fluids and, you know, just some warm fluids, some nebulization and stuff. But if you're spiking a fever of more than 100.2 or more than that, and you have like sore aches and body aches, I think you should. And especially if you have children around you or elderly people in the house, you don't want to get them flu. So it's always good to contact within the first 5 days.
Okay. You know, a lot of people have been talking about, you know, I didn't get the flu shot this season. Should I still get it now? Do you still recommend getting the flu shot?
Yeah, definitely, because the flu season is very extended starting from October, it goes up till March, so you are susceptible to getting flu anytime in between. So you can still get it.
Okay, I know we had a question that came in. Someone asked, I got the flu vaccine in August, so it seems pretty far back. Do I need to get it again? Is that still in the window?
No, I think it's fine if you've got it once. Yeah, this season, but you have to get the current flu shot like this season, because every season they're developing a new flu shot based on the strains that we're predicting for the season, for the year.
So we heard that the flu shot this year wasn't as effective as maybe people would like. Is there truth to that?
So the thing is that this season there's a virus called influenza A, H3N2. So this season they have created a vaccine which is for H3N2 as well as H1N1 and influenza B. So it is 10 to 20% effective for H3N2, but it's also very effective for the other types. So if you get not everyone is going to be infected with H3N2, which is this season's primary flu, but they might be infected with H1N1 and influenza B. So in that case, the vaccine is going to help them.
Okay. We have a question coming in on Facebook. Best way not to get it? Is there any vitamin to take to help adults and kids avoid it?
Yeah, there has a lot been talk about taking essential oils or vitamins. Nothing is actually effective in terms of proven medically to which can keep you away. I mean, keeping your immunity with vitamin C is a good thing. That's general. It boosts your immunity, but something specifically for flu doesn't really, it's not proven.
Okay. We have seen the flu now in our state kill, it's caused death to adults and a child. Now, I've heard a lot of people ask, how does that happen? I mean, how does the flu cause death?
Yeah, I mean, it just can cause a lot of complications. It's a virus. It can go in, invade your cells, stay in there, and then it can cause pneumonia. It can cause ear infections, sinus infections. So one thing leads to the other, and if your immunity is not good enough to, just fight against it, it's going to just disseminate into the body. And
so it's usually the complications that go along with it?
Yeah.
Okay, another question on Facebook. Is getting a second flu shot, does that increase your chances in avoiding the flu? Should you get two?
Really. No. One is enough. All of us get one, and that's pretty much good enough.
Okay, someone else said literally everybody I know who got the flu shot this season has caught the flu.
Yeah, I heard that. And then they ask why the flu shot. So the thing is that it's not just to protect yourself, it's also protecting others. Because if you get the flu shot, there's less chance that you're going to get the flu. And the people who are around you, like elderly, the cancer patients who are immunocompromised, the children, they will have a lesser chance of getting the flu. And also, if you have the flu shot and you get the flu, the recovery recovery period is faster. You don't get that sicker. You don't go to hospital. There are less chances that you will end up in a critical care unit, and there is more chance that you will recover sooner than,
Gotcha. So you might still get it.
Yes.
But your symptoms may be
milder, and your recovery phase will be faster.
Okay. Another question. We've seen people whose symptoms were hives. Is that a symptom of the flu? And what are some other symptoms?
Of like getting the vaccine? You mean like a side effect of vaccine?
Yeah. This is actually just people who, it said we've seen people whose only symptoms were hives. What should we be looking for? Is that a symptom of the flu?
No,
That probably
not
wasn't
really.
the
No,
flu.
they should contact their primary care physician and see if there's any underlying reason for hives.
Gotcha. Another question. So people will be jumping on with us. I know we just asked her this, but I'll ask you again because we had the same question. How is it that people are dying from the flu?
So yeah, it's like I said before, that you get the flu and it's keeping you very, you have body aches and pains, and you're very tired, runny nose. And if normally people recover from it just by taking hot fluids, staying at home, resting. But if you're immunocompromised, or your immune system is not that good, you're not going to boost a fighting system against it. And then one thing leads to the complication, like you can get a pneumonia in the lungs, you can get sinus infection, ear infections, and it's basically the infection and the superimposed bacterial infection, because virus makes you like immunocompromised. You're not good enough to fight against it, your white blood cells, and then you can have a superimposed bacterial infection, which is much fatal, or that kind. It's serious.
What is the typical treatment for the flu?
So if you come within the first 5 days, which is the window for the flu, we give you Tamiflu, which is oseltamivir. So it helps to, reduce the recovery phase, and it's the treatment. But out of that 5 days window, it's just mostly just the symptomatic treatment, like fluids, rest, good intake. It's just supportive.
Okay.
Yeah.
Can anyone get the flu shot? What if I have allergies?
So they can, except that in some few cases where they had a flu shot last time and they needed epinephrine, like a severe anaphylactic reaction where they had to get an epinephrine shot. In that situation, or if they are really sick and have fever, very high grade fever, we normally recommend them not to get the flu vaccine.
Another question coming in on Facebook. When you get the flu shot, you automatically get sick first, right? Is that true?
No, it's not a live vaccine, which means it cannot give you flu. So what you normally get are just some side effects, which normally people see, like maybe a little bit of pain, soreness where you get the shot, but you don't get the flu from the flu shot. It's just more like, it's how we're wired in the brain.
So just all the myths that float out there about the flu shot, right?
True.
Okay, so let's say someone in your house has the flu, one of your kids. How do you avoid getting it the best way, and try to keep everyone else healthy?
It's most like wearing a mask. Okay, just make that person wear a mask so that you can stay away, because it's going to spread through the droplet infection. So you don't want that to be around you. Or you can wear a mask around them if they're not comfortable wearing a mask. So it's more like, just isolation.
So you should make someone in your house wear the surgical mask while they're sick.
Yeah.
Okay.
Disposable mask, which is, easily available everywhere.
Okay, because how is the flu spread?
Yeah, it spreads through the droplet. It's through the, when you sneeze and, it goes in the air, and then you are able to catch it from the other person. So it's through the airborne, yeah. Gotcha.
Do people who, I'm sure a lot of people are being overly cautious right now. I mean, what are the ERs looking like, where you are? Is there a ton of people coming in thinking they have the flu?
So normally people are able to, boost an immune system against it by just doing their own thing, like warm fluids, staying at home, resting, not going to work. But it's mostly the elderly population that come in and have flu, and not really just for the flu. It's basically the complication from the flu that they come in with, like a superimposed bacterial pneumonia.
Gotcha. Okay, another question. We were talking a little bit earlier about these do-it-yourself flu kits to have at the house. Hand sanitizer, should that be everywhere in your home?
I mean, it's always good to have hand sanitizers. I'm always in for that. But the flu kits, I'm not really sure about
Okay, the flu kits. Okay, yeah, these were just some do-it-yourself kits to have. It said hand sanitizers, decongestants, pain relievers.
Yeah, pain relievers and Tylenol should be fine. Yeah.
Okay. How long is the flu typically lasting this season?
So normally it can last from few days up to 2 weeks. So yeah, people normally recover within a week.
But did you say a few weeks?
2 weeks.
Oh, 2 weeks.
Yeah.
But that's still a long time,
Yeah,
right?
it is.
Okay, so I have to ask this question because we've talked about this at work before and probably in your office. Okay, so you're starting to not feel great, and of course now during flu season you're thinking maybe I have the flu. Do you stay home right away? When are you most contagious?
So in the beginning, you're contagious when you just have the symptoms. That means you're right now in the phase where you're active disease going on. So I think just when you start having the flu and sniffles, it's always good to just stay at home. Do not infect your coworkers or anyone else. Just start wearing a mask and start your home regimen.
And then on the flip side, when do you know that you're not contagious anymore and it's okay to go back to work?
I think normally flu resolves within 4 to 5 days, and you stop having those symptoms. You might have a little bit of body aches, but the runny nose where you're just throwing sniffles and droplets everywhere, that's gone, and you don't have those fevers if they were in the present. So I mean, you can tell when you're just feeling active and more alert, and you don't have runny nose and watery eyes.
Yeah, it's tough because people feel that there's this pressure that they need to be at work, but the doctor is telling you, if you're sick, stay at home.
Yeah, stay at home, I mean, and that's why flu season shot is very important, that you don't want to, work, you don't want to miss the work or take those days off, and it can help you stay on work too. So.
Okay. If you go to the doctor, talk a little bit about the tests that they give, how simple it is to find out immediately whether you have the flu.
Yeah, within I think it's about 5 to 10 minutes, we can actually get the influenza swab, where we just take a nasal swab and we can test it within the office, and we can let them know if they're positive or negative. So if they're negative, there's less chance that they can send it to other people, but we still, if they have the symptoms, we tell them not to go to the work, just stay at home until they feel better.
I actually, I got tested this year for it because I got sick. They said I didn't have the flu when I was in there, and I was wondering, what is it testing for the strains? And are there more strains out there?
Yeah,
could you still have the flu even if that test comes back negative?
Exactly, because there are more strains than what we test for. We test for the common strains that we know of, but there are a lot of strains out there, so you can still have the flu, but not from the ones that we tested you with.
Okay, and so we talk about the flu being a virus. Is it true that that a virus really just has to just play its course? It just has to, no medicine will really help get rid of it?
The Tamiflu that we give within the first 5 days is an antiviral, so there's a medication, but it's only effective within those time period. If you don't get it within that time period, then let it have its own, run its course, and then you'll be fine. So it just gets you out of your system.
Yeah, we have a lot of people jumping on Facebook. Just want to say good morning to everyone. A lot of people saying, listen to the doctor and get your flu shot.
Yes.
So again, it is not too late to get it.
No, you can still get it.
When is flu season typically? What are the months again?
So it starts normally from October when we start offering it. So from October till March, this is when we say that you should get it if you haven't gotten it yet.
And what age for kids do you want to start getting them vaccinated?
Yeah, so anyone actually from 6 months and above is okay to get a flu shot.
Okay.
Yeah.
As for the kids, what are some of the symptoms that we should be looking for in the kids, and do we take them to the doctor or to the ER a little quicker than maybe we would ourselves?
Yeah, because we quantify them as immunosuppressed, that's someone who is not being able to, boost an adequate immune response. So if they have any symptoms, especially the fever, runny nose, headache, or, just aches and pains, they're not eating well, their appetite is less, they're crying more, that kind of stuff, then it's always a good idea to take them to the ER and have them checked out. Yeah.
What are some of the most common questions you're getting at the hospital about the flu?
Yeah, it's mostly the one they always want to ask is, we got the flu shot and we still got the flu, why? Yeah, and then how soon can we return, like you asked me. Yeah, mostly like that. the reason they're concerned is that we got the flu shot and we still have the flu. And I tell them that, yeah, but you could have avoided it if, you know, like some people would avoid it by getting the flu shot. It's not like, it's not effective. And if you were given like another strain, then you might have been not, affected at all. So it's just based on a person's own immunity and what strain affected them.
Okay. Lisa Ann saying, I tried peppermint tea. That works for me. Is there anything when you are, you're at home, is there anything that really is best to drink, besides water? Is it the Gatorades? Is it, or is there anything that maybe you should stay away from?
Not really, but yeah, like we said, everyone has their own, calming regimen. Some people like teas. It makes them very calm, and, herbal teas, coffees. You can drink anything that makes you feel better. Basically, we say warm fluids, and just keep yourself hydrated with water, and, So this didn't work. She had peppermint? Yeah.
She had peppermint tea. I also heard, and I don't know if it's just because my mom was trying to get me to eat when I was sick growing up, but they say that there really is something in chicken noodle soup that helps you. Is there any truth to that?
I think it's the nutrition that helps, and the warmth of the soup. But anything that's warm and healthy should help you.
Okay. Someone said my doctor didn't have the flu shot. She told me to go to the market to get one. Are we seeing, are there enough flu shots out there?
Yeah, I mean, we at GBMA, we always have the flu shot, but you can always get it from, CVS, pharmacies, and, Walmart, I think, offers it, but there should be enough.
I know we did ask you this, but someone's just jumping on. How long does the flu usually last?
So it can last up to 2 weeks, but it normally subsides within a week.
Okay.
Yeah.
And just one more time to clear that up about how long you should stay home. Because if it lasts, let's say 2 weeks, are you okay to go back to work at some point?
I mean, that really depends on how bad you are affected in the first place. What were your symptoms? I would defer it to your primary care physician. You go and have yourself checked out if you have more severe fevers, let's say, if your course was really severe in the beginning. So I think it would be something that they need to discuss with their primary care physician.
Okay. Yeah. And when should you go to your primary care physician? Do you wait, a few days to see if the symptoms stick around?
I think it's better if you go immediately, because if you are within the first 5 days, you can get the Tamiflu, which is going to help you, fight with flu. So if you wait and you're out of that window, you cannot get it, then you'll just have the virus run its course. So it's better to go early. And then if you're spiking fever, if you think that your symptoms are, rather than going down, they're building up, then you definitely need to see the doctor again.
Another question, somebody just jumping on, when are you not contagious anymore?
So I don't know the definitive answer to that, but I think it's once you stop having the symptoms, that's when. Yeah.
How does this flu season compare to others in years past?
So I think more people are getting the flu this time, even after the flu vaccine. Like I said, this season we are looking at the H3N2 strain, and the vaccine that we have is just 10 to 20% effective against the H3N2. But people are also getting affected from the other strains which were seen in previous years, and the flu vaccine covers them really well. So regardless of how effective it is for the flu this season, you're supposed to get it because it's going to cover all 3 antigens that are there: flu B, H1N1, and H3N2.
Kathy says 2 weeks. That's a long time, but when you get bronchitis, sometimes it can last longer. Yeah, I was sick for 3 weeks this year, and I remember thinking to myself, I don't even remember what it feels like to feel normal again. It can last. It can last. Okay, so let's see. I was reading some information about Tamiflu being very dangerous. Is there any truth to that?
Not that I know of. We recommend this and we give it to our patients. I'm not sure what type of.
Okay. Aside from getting the flu shot, what preventative measures can you take to avoid getting the flu?
Yeah, just make sure that nobody has flu around you. If they have, just let them know that they need to take either day off or they need to wear a mask and protection. And I don't think that there's anything that you can specifically do to stay away from flu, except that, you need to make sure that people have enough isolation if they have the flu, and you get your vaccine. That's the most important thing.
Okay, so get your vaccine. If you haven't had it this season, you can still get it.
Yes.
Don't feel like you need to get a second one.
No.
not going to help you.
Yeah, that's fine.
Okay, well, we want to thank you all for jumping on and asking your questions to Dr. Hira Shakeel, resident over at GBMC. This was great. Go back and watch. If you're just jumping on, go back and watch. I think we answered, a ton of questions for you. We got answers, but just stay safe. I like the idea of the surgical mask if anyone in your home is sick. And just relax and rest up and get better if you are feeling sick. So today is a day of answers here at ABC2. We're going to be on Facebook Live throughout the day answering your questions. So thank you again for joining us. We hope to see you back on Good Morning Maryland tomorrow at 4:30, and thank you so much for your time.
Thank you for having me here.